I'm Stephen Devries. I'm a preventive cardiologist and executive director of the Gaples Institute for Integrative Cardiology. The Gaples Institute is a nonprofit whose mission is to promote the role of nutrition and lifestyle in medicine, trying to combine the best of both worlds for a better health. Most patients who experience a heart event really feel like they've lost control. They feel like they're powerless. So the most important thing to realize, first off, is that you do have a lot of power and you do have a lot of control over your heart health. And it can actually be a reflective moment after a cardiac event to take stock of your life and to think about what are some of the areas that may have contributed through lifestyle and which are some ways that could be improved. Some of the key lifestyle areas relate to nutrition, relate to physical activity, and very importantly to your role with other people. Do you feel connected? Do you feel like you're working with other people in a way that is very positive? Or do you feel isolated? And does your life have a sense of purpose, of meaning? Are you pursuing the kinds of directions that really make your heart sing or that close your heart? And those are kind of metaphors for actually what happens inside. If you feel closed off in your life, very, very good chance that you'll be at risk for having different kinds of heart closures that kind of can lead to heart attacks. Well, the mind-body area is so important when trying to promote your heart health. And I don't think there's a one-size-fits-all sort of approach, but I do think it's really important to explore a whole arena of different choices and to see which really fit best with the individual's own life experiences, with their personality. Some examples, meditation has got a lot of evidence to support its use. In fact, there's a study showing that given the same sort of medical treatment after a heart attack, people who do regular meditation cut their risk of a second heart attack by 50%. It's very powerful. But meditation is only one approach. Others are biofeedback. Biofeedback might be helpful for some people who are a little bit more kind of quantitative oriented, who want numbers and measurements and who really respond well to that. Then other approaches for some people, physical activity helps clear their mind, and that's great. And for other people, there are other modalities in the integrative sphere that really resonate with them, Reiki and healing touch approaches that kind of reflect from the idea that people have an internal strength and energy that can be altered to their betterment. And so I think there is not a one-size-fits-all, but I do think it's important that everyone be kind of introduced to the idea that the mind and the body are really important interactions that need to be considered in whatever format works best for that person. Well, the first great point is that people are thinking about exercise, and that's the most important. And then the next question is how much to do. And really, it's not about exercise. I like to frame it more as physical, being active. Because exercise sounds kind of onerous, like something you don't really want to do, maybe, but being active, is a different framing, and I think a better one. But so there are some issues. If people have had a heart problem, I think it's important to check with your physician and find out if there are any limitations based on the condition. But then within the framework of what is considered medically safe, it's first of all very reassuring that even a small amount of activity goes a long way. So even walking at a gentle pace for 30 minutes a day confers very significant benefits. It's great. So if that's the level, either that's medically safe or that, based on limitations that you can do, terrific. It's a lot. But then if your medical condition allows more, being a bit more active, doing things that will intermittently raise your heart rate a little bit more if it's medically considered safe for you, would be great. There's up to a point, more can be better, but only for some people and only to a point. The important thing is to really recognize that a little bit of exercise goes a long way. Walking is great. The other part about walking that's important to realize is that you can break it up. Many people think, 30 minutes a day is their goal, and that's a good one, but it can be broken up into 2 15-minute periods or 3 10-minute periods. So if it's hard to find 30 minutes at any one point of the day, it's great to do 10 minutes before work, 10 minutes during lunch, 10 minutes after work, if that works best for you. The other important thing to know about exercise is that many people feel that exercise is only helping them if it's causing them to lose weight. And that's actually not at all true. There are a lot of studies showing that for people who are overweight, that being physically active tremendously reduces their risk from a whole variety of conditions, including heart disease, even if the physical activity they're doing doesn't cause them to lose weight. So obviously, if you're overweight, losing weight would be a great thing, but don't feel like exercise is not helping you if it's not causing you to lose weight. Well, there's a lot of data showing that people who are relatively isolated are at increased risk of heart problems, and people who have more social connections are at much reduced risk. And it's really not clear why that is, but you can imagine some of the reasons that when people feel satisfied, they feel fulfilled, typically they're more relaxed, their blood pressure is lower, their heart rate is lower. They just feel better. There are myriad ways that social connectedness helps people's health. Some of them even have been looked at on the genetic level. But it's not so important to actually know the mechanism, but to know that it's really powerful. So I really invite people, especially after they've had a heart problem, to really look at their life and look for opportunities to expand their network, usually along either the lines of family or friends or personal interests, to find, what is it that appeals to them, if it's a religious affiliation, if it's a hobby, or some sort of spectator thing that they can do with a group of people, a club. But whatever appeals to people, to look for ways to strengthen the bonds they already have. Because sometimes after a serious illness like a heart problem, people can sometimes tend to feel isolated. They can be withdrawn because they feel like they're vulnerable. And the natural tendency is to kind of close in rather than to reach out. And it takes encouragement sometimes to go in the reaching out direction, but it's one of the most health promoting steps that people can make. So social connections and their importance can't be overemphasized. There is a lot of data showing that people who feel like they have a purpose in life, people who feel like they're fulfilling kind of their heart's dream in whatever way, in their family relationships, in their professional life, in pursuing hobbies or volunteer work of interest, that those people enjoy better health. And it's not entirely clear why that is, but it's easy to speculate that people feel fulfilled. They feel like they're doing something really important, and in so doing, they have a reason, a will to enjoy better health, as opposed to people who feel perhaps that they're not doing what is important to them, so why should they continue? And what's interesting is that people's mental state really drives their physical health in such powerful ways. There's data about sense of purpose and lifespan. There's data relating to sense of purpose and recurrence of heart problems, and optimism and recurrence of heart problems. So it's not easy to say, okay, go have a sense of purpose, that's my prescription. But it really, as I mentioned earlier, kind of invites you to kind of reflect on your life and think about, what is important to me? And even to ask the question, okay, I've had a heart problem, I've had a serious scare. Why, I want to continue, being healthy, but the question is why? Why do I want to continue? And the issue I think that really merits kind of self-exploration is what's important to me. And I think as people learn and act on the answer to the question of what's important to them, it really extends not only the length of their life, but the quality of their life. I think among the constellation of integrative modalities that are helpful, massage is a really powerful one that I would strongly recommend that people consider to be part of their program. I think that other modalities for some people, chiropractic can be helpful if they have especially musculoskeletal problems. I think that Tai Chi can be an amazing practice, Qigong. They're really practices that help not only coordinate your body, but settle your mind kind of in concert with settling your body in a slow, purposeful, and really beautiful way. So I would encourage people to explore those modalities. Acupuncture can be helpful for some people, especially in pain management. So again, I don't believe that everyone should or needs to make use of a whole set of modalities, but for many people, choosing one or two or three that resonate with them, that fulfill their physical or spiritual or mental need, also based on their history and based on kind of their idea of what sort of philosophy of healthcare they embrace. Some people are drawn to kind of more of an Eastern style approach, and they are really drawn to things like Tai Chi and Qigong. Others are more quantitative and are looking for something like biofeedback that we talked about. Each to their own, but I think to make certain that there is a whole palette of options that people have exposure to and knowledge of, I think can be incredibly helpful and really often missing in conventional medicine, and can add so much to people's health and sense of well-being. We began the Gaples Institute, which is an educational nonprofit, with the goal of promoting nutrition and lifestyle in medicine, to highlight the absence of it in most medical encounters, and to really focus greater attention, both educationally for health professionals and for the community. I invite you to check out our website, which is at gaplesinstitute.org, G-A-P-L-E-S institute.org, and you'll see information focused on healthcare professionals. You see information focused on the community, down to the level of what should I eat for breakfast? What are some healthy options? Where can I go to get more information about some integrative approaches? Really how to take the best science and put it into play.